going to discuss about, as I had already made a video on diabetes. Okay, just basics of it we had already discussed. What is diabetes, what are the normal levels, and if a diabetic patient come to you, and then what do you suggest to him? First of all, what do you think, what do you tell to him first as primary treatment? So we will tell to him, like, do regular exercise at least for 30 to 45 minutes. So 150 minutes per week. Okay, at least 5 days of the week you should do the exercise, and you should take proper diet. Okay, if the patient is so thin, you should advise the diet which make him gain weight. Okay, so these things you will tell to the patient, and if the patient is very obese, then you tell the patient to take the diet which helps him to reduce the weight. Okay, as the glucose is continuously going through the urine, then obviously there is weight loss for him, even though in spite of the huge amount of glucose in the blood stream. Okay, so first you are advising diet, and you will say to do proper exercise, and in diet you will say to consume carbs for 45 to 65%, and protein like 15%. Okay, and fats up to 10 to 15%, you will say, you will advise him. So this is about the balanced diet what you will advise, and you will advise him to take proper fiber content. Okay, which help him to reduce the bad cholesterol, and digestive problems also it will avoid. Okay, so as second line treatment, what you will advise to him is oral antibiotic drugs. Yes, no? So oral antibiotic drugs, those promote the insulin secretion, those enhances the absorption, and those which decreases the carbohydrate metabolism. Okay, those which acts at the receptor level, like SGL2 receptors level. So these things you should be knowing. These are the four different types of the drug, types of the class of the drugs, which we had already learned in pharmacology. So now just we will just brief out about sulfonyl ureas in this short session. Okay, so coming to oral antibiotic drugs, we have sulfonyl ureas, biguanides. Biguanides means metformin, which is commonly used anti-diabetic drug. Okay, thiazolidine diones, alpha glucoside inhibitors, meglitide derivatives, glucagon like peptide 1 agonist, DPP4 inhibitors, SGLT2. Okay, this SGLT2 things, amylino mimetics, insulins. Okay, insulins we are not bothered in this class. Okay, we'll have separate class on insulins. Okay, and I'm doing like each of the class separately. So today exclusively we'll learn about sulfonyl ureas. Okay, so sulfonyl ureas, these are most commonly and most effectively used in type 2 diabetes, and they are not effective in type 1 diabetes, as there is complete beta cell destruction in the type 1 diabetes due to autoantibodies against the beta cells. Now we are not bothered about type 1 diabetes, so we are not giving sulfonyl urea. They are not effective in type 1 diabetes. Okay, so coming to sulfonyl ureas, glibenclamide. Glibenclamide causes hypoglycemia, which is adverse effect of glibenclamide. So we should see, and the sulfonyl ureas is cost effective. Okay, gliclazide and glipizide, these have few side effects, and they are short acting. Limiperide, which are normally noticed among us during our posting hours, when we see the drug history of the patient, we probably using the glimepiride as anti-diabetic drug, which is long acting. Okay, so we have after many years of the diabetes mellitus, then beta cell function what will happen, will completely stop. Then there will be insulin secretion gradually stops. These sulfonylureas which enhances the insulin secretion. Now there is no point of insulin secretion, then which leads to the failure of the sulfonylureas, which is known as secondary failure. They fail to act because there is no insulin secretion, then they can't act, and there is secondary failure. So how they will act, mechanism of action: sulfonylurea stimulates the release of the insulin from the pancreatic beta cells. So they act on the sulfonylurea receptor, and this further linked to the potassium channel on the beta cell surface. So then there is potassium transport occurs, which means it acts on the H plus K plus pump, and which after the opening of this uh, channel, then there is when the potassium transport occurs, which triggers the insulin secretion. Okay, insulin secretion from the beta cells. So what are the contraindications of the usage of sulfonylureas? Who can't use these? Severe liver and renal impairment patients can't use the sulfonylureas because it further aggravates the symptoms. Side effects: what are the side effects? Hypoglycemia, surely you will have hypoglycemia, as which decreases the insulin secretion. In high dose you will have hypoglycemia. Idiosyncratic reactions like skin rashes, leukopenia and thrombocytopenia are common with the use of the sulfonylureas. Thank you guys. Today we had discussed about sulfonylureas, which is very important. These all drugs are important. So in one video we will discuss one class of drug. Okay. Thank you guys. Thank you. Stay tuned. Bye.